Hello, everyone, and welcome. Before we begin, I'd like to take a moment to respectfully acknowledge the traditional ceded and unceded territories of the Indigenous peoples across these lands that the colonizing peoples now call Canada. We're deeply grateful to live, work, and learn on these lands, which have been cared for by Indigenous peoples for thousands of years. We honor the lasting connection between Indigenous peoples and their traditional territories. We recognize the importance of learning from, respecting, and amplifying the histories, cultures, and contributions of all Indigenous peoples. And we humbly acknowledge the need to work towards restoring meaningful, honorable relationships with them, which includes advocating for the co-creation of culturally safe healthcare systems, the closing of any health gaps between Indigenous and non-Indigenous peoples, and the embedding of Indigenous wellness into all aspects of kidney healthcare. Today, I'm personally joining this event from the traditional territory of the Haudenosaunee, Haudenosaunee, and Anishinaabe peoples. This land is covered by the Upper Canada Treaties and protected by the Dish with One Spoon Wampum Agreement. My name is Michelle N. Goodfellow, and I'm the Communications and Engagement Manager for the PKD Foundation of Canada, which is the only national organization solely dedicated to fighting PKD through research, awareness and advocacy, and education and support. Our topic today is mental health in late-stage PKD, especially as you're approaching or throughout your dialysis. There will be a live question and answer period in the second half of today's presentation. Feel free to leave your questions anytime in the chat or in the Q&A area. I'll now briefly introduce today's presenters. We're going to have Dr. Gavril Hercz, who's been a nephrologist for nearly 40 years, helping build Hennig Humber's Hospital's nephrology program, which now cares for over 600 dialysis patients. Seeing how kidney disease impacts both body and spirit, he trained as a psychoanalyst and developed psychonephrology, an approach that addresses patients' emotional as well as medical needs. He created a transition care unit to support people starting dialysis, focusing on anxiety, depression, and the loss of independence. This innovative program has improved patient well-being, inspired other hospitals, and earned Dr. Hercz the International Psychoanalytical Association's inaugural Community Award in Health. Cinzia Di Carlo, MSW, RSW, and psychotherapist, is a renal social worker with Dr. Hercz at Hennig Humber Hospital. She provides support to individuals approaching the need for dialysis and those currently receiving treatment. She works with patients and their families to support those living with chronic kidney disease and polycystic kidney disease through education, counseling, and compassionate care. Cinzia is committed to providing a culturally safe and patient-centered approach to care. Her approach is trauma-informed and strengths and empowered-oriented based. Cinzia also has counseling experience with individuals experiencing trauma, anxiety and depression, grief and loss, intimate partner violence, as well as coping with life's transitions. She is one of the 2025 recipients of the Kidney Foundation of Canada's Ontario Impact Award. Welcome, Cinzia.
Thank you so much.
You're welcome. Today, we're going to start with a presentation by Cinzia about mental health and late-stage PKD, and then Dr. Hercz will join us for an extended question and answer period when Cinzia's done her presentation. So go ahead, Cinzia.
Thank you so much. I really appreciate it. I'm going to now share my screen. Just give me one moment. Welcome, everyone. Good afternoon. I am so happy to be able to present to all of you here virtually. Thank you for welcoming me into your space. So I'm glad to present on a topic that I am very, very passionate about, which is mental health and coping with PKD. Thank you so much for the wonderful introduction and the land acknowledgement to Michelle. I will, of course, just add to my own land acknowledgement that I am currently in Toronto. My parents are immigrants to Canada from Italy. They have benefited from this land through their jobs and purchasing of land to make their home. I've also done the same with my own family that I have created. I am making efforts to unlearn racism, discrimination, stereotypes that I have learned over time through formal education, acknowledging my bias through active self reflection, especially before I meet any of my patients and clients. I ask questions, I listen without defensiveness to really understand those that have experienced and continue to experience racism, and also how I can take better action within my community and within Canada. I'm hoping to do this to become a better ally to all of these communities. So let's get right into it. First, I want to just acknowledge these are some of, not all, but some very common psychosocial impacts that I feel that impact our community. Everything from information overload, restricted to the burden of disease and treatment. So, we're seeing possibly loss of interest, fatigue, maybe consumed by treatment schedule, restrictions of travel potentially, fending for oneself in healthcare, really just feeling like there is some uncertainty, maybe no one to relate to, diminished societal role. This is especially where I come in as a social worker. We're grieving the loss of opportunities, social consequences maybe of being unable to work, vulnerability in the external environment. Of course, there's potentially some risk of infection, feeling excluded and ostracized. I feel like, there would be a lot of anger and withdrawal, maybe even feeling disconnected, fear of stigma or being misunderstood, maybe even guilt of burdening others with your story, underestimating self-esteem. So this is where I find that there is, anxiety, shame, potentially, self-consciousness about maybe appearance, and maybe even unable to gauge in activities that maybe you previously enjoyed. There's also psychosocial impacts when it comes to, again, we've talked about employment and finances, maybe even transportation and home care. So I really just want to start off with that these feelings, hopefully some of you out there that are listening to this presentation are sort of nodding or sort of agreeing that yes, these are some of the feelings that you have experienced. I just want to first and foremost say that these feelings are completely normal. Speak to your social worker. Most, if not all of these teams do have someone like myself that is a social worker on the team, whether it be in your multi-care kidney clinic, those that maybe have started dialysis, there is a social worker there too. Please speak to them. They have phenomenal counseling skills, phenomenal listening skills, and want to build a rapport with you. What you see on your screen is actually from a movie from Disney. These are all of the little emotions. I put this up and I do this to remind everybody that all of these feelings are normal, whether it be anything from joy to anger, to sadness, to anxiety and fear. They all exist within us. So I wanted to talk a little bit now about trauma. Okay, definition is there on your screen. But the reason why I really wanted to talk about it is because trauma can have several effects, including anxiety, depression, disturbances and difficulties relating to all emotions. And this can contribute to everything from difficulty with sleeping, impulsive behavior, substance abuse, self-harm. There's no single intervention or approach to help with trauma. So this is important to know. And really what I consider traumatic doesn't necessarily mean you consider it traumatic. But the reason why I bring up trauma is because you yourself may have been exposed to several traumas, maybe seeing a family member previously coping with PKD. And now you yourself are dealing with it as well, or similar symptoms, igniting similar feelings. And I often start many discussions with patients in MCKC or who are actively on treatment by acknowledging that this is a trauma, acknowledging that they have endured a trauma, and in turn are a trauma survivor. You are a trauma survivor. So some of the common reactions to trauma you can see on your screen, and I wanted to sort of talk a little bit about them. As trauma survivors, we re-experience our trauma through thoughts, feelings, memories, and other means. So re-experiencing the trauma can be very distressing. It may trigger uncomfortable emotions like fear, anger, sadness. People can have nightmares or flashbacks, distressing thoughts, feelings about their trauma. Sometimes we may even avoid the trauma reminders because the reminder can be so distressing that it's common for trauma survivors to even avoid certain things to control some of these reactions. It might be, for example, an avoidance of people, places, or things related to the trauma, maybe even avoiding medical appointments related to our PKD. We might want to suppress thoughts related to the trauma, maybe avoid conversations related to the trauma, which is, again, all completely normal. These are common reactions. Negative thoughts or feelings, they may begin or worsen after experiencing a trauma. So some of these thoughts and feelings might not seem directly related to the trauma. We might have excessive blame, loss of interest in activities, feeling isolated or disconnected from our surroundings, and maybe even difficulty experiencing positive feelings. And lastly, I wanted to talk a little bit about hyperarousal. And this is sort of the feeling of being on edge. May again begin or worsen after experiencing a trauma. We might feel irritable, quick to anger, feeling aggressive, maybe a heightened startle reaction, or even maybe difficulty concentrating. So, a major reason why I discuss trauma initially is to acknowledge that what you've endured is traumatic. And we don't often do this. We often associate trauma with things like a motor vehicle accident or a death, but not so much chronic disease. But I'm sure that many of you, after learning about what trauma is and the common reactions to trauma, may identify with some of these feelings after learning about your PKD. And sometimes there's comfort knowing that these feelings that you're experiencing are related to your decreased kidney health and trauma. Oh, I'm sorry. My apologies. Okay, so here we are. So I wanted to talk also a little bit about health anxiety. Okay. Health anxiety is a very normal response to chronic illness. And sometimes health anxiety can become really disabling, and that's when it's problematic. But again, just like I was mentioning before, all of these feelings are normal. Fear is a normal response to disease progression. Um, Questions can occur like, will our medications continue to work? If not, how will dialysis look like for me? Will I suffer a lot? Will this be passed on to my children? And dare I say, will I die? So since fear is a normal emotion, and it's, in fact, fear is a good emotion. It alerts us to danger. And living with chronic disease can cause our fear alarm to go off often, and we can become very sensitive to it. And experiencing PKD, our body remembers this, like, for good reason. Our fear alarm is going off. So we want to start to have, what we want to start to do is we want to use our cognition to help to respond to our fear alarm instead of maladaptive ways to dealing with our trauma. So remembering common reactions to trauma, like we just spoke about, maybe avoiding medical appointments, withdraw from family or friends, as a means of maybe not revealing too much about ourselves, again, out of fear. We want to be able to manage our health anxiety to enjoy a good quality of life. Have that awareness. So now I want to also talk a little bit about grief and loss. I want to shift gears a little bit here. And I like discussing ideas around grief and loss when it comes to speaking, when I speak to patients in the multi-care kidney clinic or even receiving dialysis treatment. Again, ideas around grief and loss are often associated with passing, with the passing of a loved one, and they're not actually usually associated with PKD or even the need for dialysis treatment. However, when this does happen, we suffer an incredible loss. And this loss or changes, again, could be job financial strain, status, family structure, changes in roles, changes in relationships, or maybe, again, even the ability to not travel as frequently or with little notice. And, to add to this, we're battling fatigue, weakness, and the way we feel is very similar to feelings that when someone suffers a loss. We feel angry. We want to deny it. We want to bargain. We have depressive symptoms. And these are all themes that I'm taking from Kubler-Ross's stages of grief. But what you see on the screen here is a grief model that I like better. And it's because it's not linear. Because I believe that when we suffer a trauma or loss, we never truly get over it. The trauma and loss becomes part of us. It becomes part of who we are. And I like the idea of oscillating back and forth between the stages that you see on the screen. So just like a pendulum. And I like that because I like that we can go from being loss oriented to restoration oriented, and we can keep going back and forth. Making note that both of these are very stressful stages. We tend to believe that the restoration or that adjustment or accepted stage is better, when really it isn't. Again, with chronic kidney disease, PKD, the beginning of learning how to like the beginning of new ways on how to do things like training for home dialysis, adjusting your new work schedule, learning how to book a dialysis center overseas for an upcoming trip. This is all very, very stressful. And, I've always admired the way children are so good at being able to go back and forth. And, like when they're sad, they're truly sad. And when they're truly playing and they're having fun. I admire their flexibility to do this. But yet, as adults, we're not really able to do this well. I think about, why do we struggle with that as adults? And as it pertains to, chronic kidney disease, PKD, dialysis, as adults, do our beliefs tell us that we should be over it? Meaning that, it's been a year since we've been diagnosed with PKD. Why do you still feel sad? Is maybe what some, either we're questioning it for ourselves or perhaps other people are doing that. So the great thing is with this model and with ourselves is that we can go back and forth between these stages and these feelings, knowing that the way we feel in the moment isn't going to last forever. So it's important to be mindful. So we're going to talk about ways to do that next. Okay, so as we start thinking about mindfulness, I want to start off with this idea of the window of tolerance. So I know it doesn't look like a window, but let's imagine a window in our home. And this was created by Dr. Dan Siegel. It's space. So right in the middle, the window of tolerance is a space where we can handle stress in a healthy way and still be able to function and thrive. Again, remembering that stress, anxiety, these things are like joy and excitement that are never going to go away. We all have stress and anxiety. But what we want to do is, again, be able to do it in a healthy way where we can function and thrive. So the size of our window is different for everyone. Someone can have a very small window. Some people can have it very big. And of course, sometimes it can change even for us every day, every hour. And we can also change our window of tolerance by practicing ways to cope. So remembering that, again, it never goes away, stress and anxiety, but we can become self-aware. When we are leaving, whether it's slowly or rapidly in the fight or flight and freeze, so when we're leaving that window of tolerance, we can practice ways to get ourselves back to feeling more safer and more grounded. So it's all about acknowledgement and acceptance. Mindfulness means paying attention to the present moment without judging it or trying to change it. We want to recognize when we're getting close to the outer edges of the window of tolerance. So we can use things like mindfulness to help us to realign. So there's two key elements, and you'll see them on your screen to being mindful. Okay. So number one, acknowledgement. So this is noticing your thoughts, your feelings, your sensations as they happen. So the goal is to not stop thinking about it. It's just simply to become aware of the experience without getting lost in it. And then we want to accept. We want to notice our experience without judging it or trying to change it. So what we want to say to ourselves when we're feeling anxious is we want to simply state, I notice that I'm feeling anxious. You can say this to yourself. You can say it to somebody else. You can say it out loud. Okay. I also like to think of stress as a small, funny looking cartoon character. You could even name them. When you start to feel anxious or stressed, acknowledge, I'm starting to feel anxious right now, and accept it. I know that I'm feeling anxious, but it is only a small part of me. It's not all of me. Let's think of a wide angle lens technique. When we take a picture, a panoramic picture, that again, that small, funny looking cartoon character named anxiety is there in the picture, but it's not all of us. Okay. We don't want it to overtake the picture. So, another important piece to managing anxiety is to be able to question our thoughts. I often introduce cognitive behavioral therapy, CBT, concepts to some of my patients and clients when providing emotional support. So, what CBT suggests is that our thoughts, our feelings, and our behaviors are all interconnected. And if we can change our thoughts, we can subsequently change the way we feel and behave. Okay. So, right up on your screen is something that I always even say to myself, just because I think it doesn't mean it's true. Okay. So, let me give you a little example. Okay. Let's say that you shared with someone that you have PKD, you may need dialysis treatment, and maybe you're considering a home modality. That person immediately tells you that you're making the wrong decision about considering a home modality because they had a great aunt that did it and it was a complete disaster. Maybe even a family member, close family member of yours. So, what happens first is our thoughts. You see, it's right at the top. That's our interpretation of the situation. And in that situation, what could our interpretation be, right? It's that it's going to be a disaster, is that it's maybe not for you. And maybe you're even confused as to why your nephrologist or nurse or even home modality educator would even suggest it. Next is your feelings. And that could even have a physical element to it. So, for example, you could be angry at even the fact that they made that suggestion to you for a home modality. You might have disappointment, anger, sadness, because you were actually kind of really up for the idea of it. Maybe even physical symptoms like a stomach ache because now you're nervous, you have low energy, because you feel sad and have depressive symptoms. And last is our behavior, which is our response to the situation. And this could be doing something about it or maybe not. Because perhaps in this case, you would choose to inform your home modality educator that you're not going to pursue it. And maybe, or you might maybe do nothing about it by maybe not replying to any telephone calls or emails about it. So, let's try to use the same example, but we want to change our thought. So, which in turn will change the way we feel and the way we behave. So, let's take the same situation. What if we were to change the thought from, this is going to be a disaster, it isn't for me, I can't believe they suggested it, to, just because it wasn't for them doesn't mean it isn't for me. So, in turn, this perhaps would make us feel maybe quite neutral or maybe even indifferent with the person's story about their great aunt having a home modality. Um, you may This may even get you thinking about maybe some questions that you want to ask. So that's the behavior. So you may want to reach out for a second telephone call or email to your nephrologist or home modality coordinator or nurse to talk a little bit more about making that decision. So again, just because we think it doesn't mean it's true. So I wanted to add a little bit more of cognitive behavioral strategies that I find super helpful. So again, we want to remember that our thoughts are not facts. Just because we think it doesn't mean it's true. I said that before, and I want you to keep it's so easy. I want you to keep repeating that. So sometimes our thoughts could be irrational. Just like I mentioned before, sometimes they can be harmful when they're frequent. Okay. So sometimes we want to put our thoughts on trial. So we want to list evidence for or against that thought. Okay. Sometimes by actually physically doing that and writing down the evidence for or against a thought, we actually realize that just again, because we're thinking, it doesn't necessarily mean it's wholeheartedly true. I also like the idea of talking a little bit about cognitive distortions. Okay. So I've put a few of them on this slide, but there are plenty of them. Okay. And really, what again, these are the irrational thoughts. Okay. And again, we might do things like magnify or minimize. So we want to sometimes and I know I do this sometimes, we exaggerate or minimize the importance of the event. So we might believe that some of our own achievements are unimportant, catastrophizing, seeing the worst possible outcome of a situation, or maybe even we disqualify the positive. So that's only really recognizing the negative aspects of a situation, while maybe even ignoring some of the positive outcomes in a appointment that you've had with your nephrologist, right? We're only focusing on the negative. We disqualify the positive. And another thing that I really like is using positive self-talk. I do find this to be very helpful with health anxiety. Using I statements or reality orientating statements to really silence that inner critic of ours. So things like saying things to ourselves like, I can't know the future. Or maybe I am safe at the moment. Or lastly, this is not happening right now. Okay. So this is something else that I really like. Seems simple. Breathing. We do it all the time. But I love deep breathing. It's something we do all the time, yet we forget that it is a great relaxation technique when we take slow, deep breaths. So when we practice this regularly, deep breathing can actually provide immediate and long-term relief from stress and anxiety. So during periods of anxiety, the body triggers a set of symptoms called a stress response. So remember some of the symptoms of trauma that we discussed earlier. So breathing is shallow, rapid, our heart rate increases, and muscles can become very, very tense. In opposition to our stress response is a relaxation response. So when we do deep breathe, our breathing becomes deeper, slower, and symptoms of anxiety try to fade away. So deep breathing really triggers this relaxation response. So I know that some of you might be listening, hopefully in an area where we can practice this a little bit. Okay. So I want to do this together. I'd want to do this for a couple of times just to really be able to show you its benefits. So what we're going to do is we're going to inhale for 4 seconds. We're going to do that through our nose. We're going to hold for 4 seconds. And we're going to exhale for 6 seconds through our mouth. And we're going to try to do that as if we were blowing through a straw. And this is really just to be able to slow down our exhale. We don't want to just do a huge breath out. That's not helpful. Okay. So hopefully all of you, if not some of you, are listening from an area where maybe perhaps if your camera's not turned off, maybe you can turn it off for a moment. Sit in a comfortable position, close your eyes or lower your gaze if you can. And I would like to lead you through some deep breathing. Typically, this is something that I find really, really helpful to do, again, during periods of high anxiety. But I recommend that you practice this every day, maybe for about 2 to 5 minutes if possible. Because again, we need to learn the habit, and we can't just do it during our bursts of sudden anxiety. We need to practice, we need to make a habit of it so our body knows what to do. So let me lead through this with you. And this is a really good way to be able to cope with those periods of anxiety as well. So I'm going to lower my gaze. I'm not going to shut off my camera, but I want everybody to, again, breathe in for 4 seconds. 3, 2, 1, and hold for 4, 3, 2, 1, and breathe out. 5, 4, 3, 2, 1. Breathe in. 4, 3, 2, 1, and hold for 4, 3, 2, 1, and breathe out. 5, 4, 3, 2, 1. One more time. 4, 3, 2, 1, and hold for 4, 3, 2, 1, and out for 5, 4, 3, 2, 1. Let's do that one more time. 3, 2, 1, and hold for 4, 3, 2, 1, 5, 4, 3, 2, 1. If your eyes are closed or you've lowered your gaze, slowly open them back up. And I know I can't see any of you right now, but when we do go into our question period, I'd love to just hear a little bit about, even just as a snapshot, how that made you feel. Some things that I also like talking about with deep breathing is, if it isn't working, slow down. A common mistake is doing it too fast. Sometimes we want to even try counting in our head. I love the counting. I do it myself as well. Counting serves as a second purpose. My apologies. Counting serves as a second purpose. It keeps our mind off of the anxiety. So if you catch your mind wandering, because I'm sure some of your minds were wandering during that time, simply return your focus to counting. Also, the 4-4-6 is simply a suggestion. You can modify that, okay? Easy to remember the 4-4-6. It's Toronto area code is 416, so I always remember it's just the change of 4-4-6 instead. So I hope that was beneficial to all of you, and some of you, if not all of you, were able to participate in that. So I wanted to also share some other grounding techniques. After this, I will end my presentation, and then both myself and Dr. Hercz, who I'm sure has joined at this point, will be able to sort of field some questions so we can use the remaining about 20 or so minutes for questions. So there are a lot of grounding techniques. Grounding techniques are simple strategies to help calm our anxiety by focusing on the here and now. So remember the window of tolerance. What we want to do is we want to focus back on the here and now, the present moment. Think about your mind as a tree and your anxiety as a storm blowing through its branches in all directions. Grounding techniques are a thing that can help you keep rooted and safe, just like a tree that faces strong winds. And like the wind that won't stop blowing, your anxiety won't completely go away either, but it doesn't need to cause you constant distress or physical discomfort. So some of these here on your screen are very simple strategies that are considered what we call grounding techniques. So 5, 4, 3, 2, 1 is a technique that takes in all of the details of your surroundings by using your senses, okay? And I could certainly go into that a little bit more during our question period if anybody is interested. I'm just mindful of the time. Categories like going back to basics. So when we feel a period of heightened anxiety, deep breathing, and sometimes, again, just sitting there and naming movies, fruits and vegetables, colors. Sounds silly, but when we have periods of high stress and anxiety, our mind wanders. Our mind gets us out of our window of tolerance, out of the present moment, and we have all of these flooding thoughts, all of these irrational thoughts. So doing something like this, again, keeps us grounded. Body awareness, bringing yourself back to the here and now by focusing on sensations of in your body. So focusing on the way your hands feel, maybe your neck, your hair, your legs, the way you're sitting. And also mental exercises as well. So anything as simple as you're in a room and you're naming all of the objects that you see. Maybe thinking of an object and drawing it in your mind, or perhaps maybe a finger in the air or counting backwards. Again, I know a lot of these things might sound a little bit silly, but it is absolutely incredible the way it gets us back into the present moment. And that's what we want to do to be able to refocus. So with that being said, we're at about the 40-minute mark, actually almost exactly. I want to thank everybody for their attention thus far. I do have a couple of other techniques, but I know that there has been a lot of questions, not only about stress and anxiety, but also I'm sure that everyone wants also an opportunity to maybe have their questions answered either by myself or by my coworker, Dr. Hertz. So I want to be able to leave some time for that. And I will put up these resources back later, but I do want an opportunity to see all of you, or at least to see a few of us that are on screen. So I'm going to end the slideshow right now. Okay. And I'm going to give, though I haven't been able to see anybody together, if there was any questions in the chat, or if anybody, of course, wants to chat with us right now, I'm going to sort of maybe give back the floor to maybe Michelle at this point, and maybe we can both field some questions, both Dr. Hertz and I. Thanks so much.
Thank you so much, Cinzia. I know that that was a really helpful way of introducing some of the feelings that people may be having about being in kidney failure or approaching kidney failure. And we really appreciate a few of the techniques that you've shared. We do have Dr. Hertz with us now. So if people have questions they'd like to ask, we've left some time for that. We also have received questions from registrants ahead of time, and we can use those if no one else has questions. Just a reminder that we'd like to focus this conversation on mental health, the mental health side of the kidney failure journey, and things about coping with uncertainty, fear, stress, caregiving, and life transitions. If you have questions about your own individual medical care, we would encourage you to speak with your own nephrologist or your healthcare team who know your situation the best. So if there are any questions, you can put them in the Q&A or in the chat. And I'll start with something that came through from one of the people who was registering. And they were asking, or they were saying, I have a fear of fistula, which for those of you who might not know is the connection between the dialysis machine and your own body's bloodstream. Either Dr. Hertz or Cinzia, what do you know about helping people deal with those fears of, having a medical attachment in your body and that kind of thing? And either one of you can feel free to respond.
Maybe Cinzia wants to go.
So, a lot of the questions that, in terms of the fistula, that I have sort of fielded in the multi-care kidney clinic when it comes to chatting about that specifically is, again, I'm very reality orientating, where of course I am going to acknowledge that there is some fear there. I do first and foremost acknowledge that fear. It is a surgery, and there does require some healing time. I do find with the fistula as well is, and Dr. Hertz, I'm sure, can also say this, can also acknowledge this as well, is that this is something that has to be done ahead of time. At least to be able to use when the person needs dialysis, to be able to use it. I know I want to acknowledge that that's sometimes very hard for people to do ahead of time, because that's almost acknowledging that this is sort of in their future. So as a social worker psychotherapist, I feel like, that some of the questions that I sort of field and counsel individuals on is specifically sort of the fear and really the acknowledgement that, hey, like if I'm doing this, it's sort of acknowledging and accepting that I'm sort of on this road, right? And dealing with sort of the feelings and emotions around that. Also, and maybe, I don't know, Dr. Hertz, if this is something that, also, I've certainly talked to people about, it being, the fistula versus the CBC line. This is something that, there is a slightly more possibility of infection, right? This is sort of, tucked away, as opposed to the CBC line. I do sort of have, discuss a little bit about that during my visits with some patients. That might happen a little bit more in the nephrologist office. I'm curious if you have anything to add, Dr. Hertz.
Yeah,
about that.
just from a different viewpoint, the problem is that these things like anxiety, worries, do not lend themselves to an easy solutions. Like, okay, I have a worry about a fistula, give me a Tylenol so I can just deal with that anxiety. Because we don't, it's almost like we see the tip of the iceberg, have a fistula, I have some anxiety, but we don't know what's underneath. So, because every individual is distinctly different from another person. So, your fistula is different from my fistula, from their fistula, quote unquote. And so it could be things like changes in body image. What does it mean to have this connection? And probably it's more so, as Cinzia was saying, if you have if a plastic tubing is coming out from your upper chest neck area, again, different body image impact. But it's all about trying to understand that individual, and that individual being able to kind of verbalize what comes into their minds, to find distinctly why for that individual this creates anxiety, whereas for somebody else it may not. For somebody else it may be that I'm totally against having another medication for my hypertension, and I absolutely refuse to take any more medications because that makes me more anxious. So I think it's more about trying to find individuals with whom one can communicate, to find individuals who are receptive. And that at times may be either a clinician, or it could be a family member, it could be a professional therapist, could be the social worker for sure, could be a peer support individual. It's where do we find comfort in sharing our anxieties and worries. And the more we can share it, I think the more grounded we may feel.
Thank you very much. There is a question, there's a couple questions now. I'll take the first one that's in the chat. Someone is saying, our son has ARPKD and is approaching transplant. I know he has fears and anxiety about his declining health. What can I do to best support him emotionally? I noticed many of the things you mentioned in your presentation are things, are things that bother him. So as a caregiver, as a parent, either Cinzia or Dr. Hertz, what are some things that a caregiver can do to help the patient that's approaching kidney failure?
Dr. Hertz, can I start off?
Of course.
So, one of the things that comes, we could spend a whole hour on that. But one of the things, first of all, Tessa, thank you so much for being so open. Thank you, Tessa, for, allowing us to just, know a little bit about your story and your son's story. And so I just want to sort of acknowledge that first. And just being such a great mother, to sort of come to something like this, to find out ways on how to help him. You just doing that alone, you just being here alone as a caregiver to find out ways that you can help him, you're already doing so much just by being here and just by trying to figure out ways to support him. As a caregiver, as someone who, and again, I'm constantly talking about the acknowledgement and the acceptance. I know that these things, these feelings, letting him know that, number one, these feelings are completely normal. Letting him know that these, not only are these feelings completely normal, but also, this is definitely, but also letting him know as well that you are here. Sometimes I think often as a social worker, psychotherapist, I what comes to mind is I often, get folks, no matter, where they're sort of coming to me at, but nevertheless having stress and anxiety. And they say to me, Cinzia, like, what can I do to feel better? What's the one thing that I can do? So I always tell people, like, it's never going to fully go away. There isn't sort of, unfortunately, a magic pill, but what you can do as a caregiver is I would really say in the beginning, just meeting them where they're at. Sometimes I feel like as a caregiver, we often want to say the right words. We want to immediately make that person feel better. And unfortunately, in this situation, I know, unfortunately, we're not going to be able to take the PKD away. But what we can do is we could just say, like, what are we feeling? Let's talk about it. I want to acknowledge what you're feeling. And I want to just really be able to, kind of just be there with you, be whatever you're feeling. I want to be able to listen to it. I want to be able to talk about whatever you want to talk about in the moment. And I want to do what you want to do right now. Because I know that as a caregiver, as a mother myself, I have a 12-year-old as well. We just want to be able to make them feel better, because that's what we want to do as Mama Lions too. And I know sometimes in these situations, these uncomfortable feelings, we're not going to be able to take them fully away. But again, acknowledging and accepting those feelings, knowing that they're going to be there, and they're going to oscillate, that pendulum, right? They're going to come and they're going to go, that roller coaster of emotions, and just being with them, you as a mom there, both emotionally, both physically, you're there physically with them, but emotionally, you're walking spiritually next to them and feeling what they're feeling in that moment. And I think that is sort of my gut answer right now for that. Dr. Hertz, I don't know if you have anything to
add. Maybe just a couple of us. First of all, I think this is a very complicated situation, because not only is it somebody who's anticipating a transplant, but we're talking about somebody who's 13 years old. So they're balancing early adolescence, and they're grappling with, on the one hand, becoming more reliant on family and people around them, because they may be feeling more vulnerable. But at the same time, there's the push-pull of adolescence and trying to become more independent. And so I think it's coming at a very tough time. I think the most important, right? So, there's, your son is sort of, navigating a very tricky road ahead that he's trying to manage. I think the most important thing is you've already done, which is that as a mother, you have an awareness of what he's experiencing, and just him feeling that somebody understands and is tuned in is probably half, the battle in terms of how to cope with this. And the other thing is, it may be useful to connect with a peer. So it may be useful at the hospital to see if somebody his age or around his age has had a transplant recently or the past few years, as a means of connecting with somebody who's a peer, who kind of say, I've been through what you're going through, and things have gone well. And I think that's a very powerful grounding effect. And it also helps him not to completely rely on his parents for all the support, as he's trying to become a little bit more independent.
And I would also add to that, like, to be able to really, like you said, like, just to be able to deal with that stage of life that he's going in, but and also acknowledge the fact of, like, his medical needs, right? To just have someone there to say, like, yeah, like, I've been there, or I am with you.
Mhm.
Awesome. Thank you so much, both of you, for the answer to that. I'm mindful that it's almost 1 o'clock, and I just wanted to do a check-in to see if either of you need to leave immediately for something else, or if you're okay with maybe going a few minutes longer to do a wrap-up.
Sure.
Yeah, I can go a few minutes longer.
We do have another question in the question and answer. I just want to acknowledge that it's there, but unfortunately, because of time, we won't be dealing with this live. But I wanted to thank both Cinzia and Dr. Hertz for being here and for presenting on this topic. One thing I would love to hear from both of you is, what can people expect in terms of mental health support that's offered to patients in a kidney care clinic, typically. And this, might be in Ontario, you're talking about what can happen in a larger hospital, but typically when someone is approaching end stage, what types of supports are available to them through their clinic or through their healthcare team?
Yeah, so I could start. And I could speak to our multi-care kidney clinic here. One of the things that I do so of course, there's myself as a social worker. I ensure that I am meeting all of the multi-care kidney patients, specifically the pre-dialysis cohort. I'm making sure that at the very least, they know that I'm here. I make sure that they know that I am here for counseling support and connection to community services. I am, while I don't know every single multi-care kidney clinic across, Ontario and Canada, I would assume that there is a social worker that's there for that counseling support that does have a good idea of what it means to, counsel those with chronic disease or chronic kidney disease. Also, part of my role is also that connection to community services as well. And that could mean anything from connecting them to support groups, peer-to-peer support through the PKD Foundation of Canada, the Kidney Foundation of Canada as well. Also, same thing, support groups, peer-to-peer support as well. I am certainly going to plug psychonephrology.com, Dr. Hercz's website that is phenomenal and has lots of information there about dealing with chronic kidney disease, PKD as well, and mental health. So I think, while I don't know the structure of all multi-care kidney clinics or dialysis clinics, please seek out that social worker in particular for that counseling support, because we all know that kidney disease does not affect just your kidneys. There is a lot going on psychosocially, and there's someone like myself that is available to all of you to, again, I tell people, I'm not able to take away what's happening. I'm not able to take away the stress and anxiety, but we can learn. There is a space here with me that's available to give you that space to talk about these feelings and emotions and to learn maybe ways to cope with them. Anything you wanted to add, Dr. Hertz?
Yeah, just from a different angle, and I think in a way, I think the PKD family is most aware of the emotional issues just in terms of because of the transgenerational trauma and how prevalent this is. And so I think there's an important role that in your community or in your care system in the kidney clinic, if there's no patient family advisory committee for kidney patients, you should advocate to establish that. And through and we have one at Humber, we had it for decades, the Patient Family Advisory Committee. And certainly hospitals now listen to these advisory committees. It's sort of part of their mandate to actually have these committees, to respond to them. It makes them look, positive that they have this. And so I think through those PFAC committees, it's very important to advocate for mental health support or to ask those difficult questions of what support are we getting and is that enough? And so I think there is a role in all of this, not just the individual patient, but as a community to advocate for these resources and to make it visible, because otherwise, as opposed to seeing medical abnormalities, sometimes it's difficult to see the emotional issues that we deal with, and it's very easy to kind of put them in a closet and not acknowledge them. So I would like to advocate for advocacy.
Well said.
Thank you. Thank you both so much. Well, I think we'll wrap up now. I just want to first of all, thank both of you for your time, for being here and fitting us into your busy day, because I know you both actively have clients or patients who are that you deal with every day. And I also wanted to let people know I have dropped a few links in the chat for some resources if you want to uh, look further at the psychonephrology website. If you wanted to look further at the Kidney Foundation has a handbook about kidney failure that's very comprehensive. And sometimes you might just want a little bit of time to sit with some of the information that you find there. But thank you, Cinzia, for letting us know what's available to people when they are being connected with a kidney care clinic, and that there is help available that way. So I want to thank you everyone for being here. Thank you for those who asked some questions, and we have been recording this webinar, and we'll make it available on our YouTube channel in a week or two once we get it edited, and you'll be able to watch it again there. Thank you, everyone.
Michelle, thanks so much for the opportunity.
You're welcome.
Thank you. And everybody, please reach out, email us if there's any, or if there's any issues or questions. We're both happy to answer and advise.